Hey friends, I'm getting on here to do a quick video on what it's like to do chemotherapy as somebody who has AL amyloidosis, and I'm not a doctor. This is just my experience. As I've said before, I was diagnosed in December of 2024, and I've been in chemotherapy since January of 2025 through today. I just had a treatment, as a matter of fact, and it is October 2025. So I've done about 9 to 10 months of chemotherapy, and this is my experience. So first of all, the treatment for AL amyloidosis is similar to that of multiple myeloma. There are many other treatments for myeloma, but this is one that they chose to put me on, and this is currently, from what I've been told, the only treatment course for AL amyloidosis. You're going to take several different drugs. Most likely, they're going to have you on an antiviral that you're going to take indefinitely. I've been told that I may have to continue to take that after chemotherapy is finished. Currently, I'm taking something called a cyclovir, and I take it twice a day, 400 milligrams twice a day. It's an anti-shingles medication, but it also helps keep you from getting infections as your immune system is low. You're more prone to blood infections and things of that nature. So, me personally, I started out with something called Cybor-D and a drug called daratumumab. The Cybor-D contains cyclophosphamide, which is also called Cytoxan. That is a chemotherapy drug. That's the one that's going to make you probably nauseous and not feel good. There's also Velcade, which is administered usually as an injection. Let me go back. The Cytoxan can be done in pill form. It can be done as an IV. Mine was done as an IV for a while, but because of my cardiac involvement, they wanted me on a fluid restriction. So I don't want to drink too much water. Don't want to have too much salt. Got to keep those balanced. And as long as I keep those balanced, I don't need to worry about as much about my water weight. It helps keep that under control because my heart function is severely impaired. My heart has a hard time pumping too much fluid. And if I have too much salt and not enough water, then I start retaining fluid, whatever fluid I got. But we want to make sure that that water works its way through the kidneys and everything. So it's important if you do have heart involvement to balance those two things. So I originally had Cytoxan as a IV, and so I would go into the treatment center. They'd hook me up to that. At some point, they would give me my Velcade shot underneath my arm, or they'll do it in your belly. It kind of depends on where you've got fat on your body. Let's see, there's also the daratumumab, which can be also called Darzalex. And you can have Darzalex as an IV drip, or you can have it as a injection in your belly. The injection is a lot quicker. It only takes about 3 to 5 minutes. They have to do a slow injection because the tube is about 4 or 5 inches long, and it's got a lot of liquid, so it takes a while. So they have to slowly inject that. So I did the IVs for a while, but we switched over to injections. So at this point, I'm doing pill form Cytoxan, injection in my belly for Velcade, an injection of the Darzalex Fast Pro. Now, along with that, they're going to make you take dexamethasone, which is a steroid, but it also helps the other drugs kind of do their job. And the steroid will help you feel pretty good for about a day, day and a half. You will crash from the steroid. There's a lot of side effects with long-term steroid use. I didn't really experience many of those. I didn't have to take the steroid every day. Started out taking something like 400 milligrams or 40 milligrams, 40 milligrams in that, and they've weaned me down to about 8 milligrams, as I don't seem to need it that much at the end of this. So I'm at this point, really, I take about an hour before chemotherapy. You'll take things like Tylenol, your dexamethasone, any meds you need for the morning. Sometimes because of the Darzalex, they'll have you take Benadryl just in case you have a reaction to it. Now, I had a severe reaction to the IV daratumumab. It actually sent me to the hospital with a really bad low blood pressure. But that was something unique to my case. If you have cardiac involvement, I highly recommend you ask to start off with Darzalex Faspro as an injection and not as an IV drip. So I had the IV drip, and they say about 50% of patients have some sort of reaction to it the first time. But afterwards, almost nobody has reactions to it. So I did very well with the um, injection. OSU had me sit around for about 5-6 hours and just to monitor me, just to make sure it was safe after the first incident. And I've had no problems since then. So, um, all in all, you'll be taking all those meds, and you'll probably be doing it every week for a while, once a week. I know they cut me down to the Darzalex being every other week, and it's still at that point after, I don't know, 4 months or something like that. And then eventually they'll have you down to maybe even like 3 times a week, or 3 weeks, 3 treatments in a month, with the Darzalex being on week 1 and week 3, and then a break on week 4. So that's currently where I'm at. Outside of that, once you finish, you'll most likely be on some kind of maintenance medication of either Velcade or Darzalex, and it'll probably be once a month. That's just what I've read. That's what my doctors have kind of been hinting at, but I won't know for a couple weeks here once I'm done and get my numbers back what all exactly I'll be doing. But there's been some people say they went on Darzalex for 18 to 24 months after chemotherapy. At that time, they decided that between them and their doctor that it was best to stop and just monitor. You get blood work every month. So far, my doctors have said I'll be on it indefinitely. So we'll see how that goes. You can see I'm a little out of breath today, so I got a little bit of water weight I'm dealing with, a little bit of cardiac issues, but that's pretty much it. So, like I said, that's my experience. That's not necessarily what your doctor might do, your oncologist might do, but it seems to be kind of the standard. And I would say 9 months is probably what you'll be doing depending on how you react. So I started out way up here, in the thousands of milligrams per liter, I think is what they measure your light chains in. And I'm down to almost normal levels, but every time I would get tested, it was lower and lower and lower. And what they want to see is something like a 90% drop. And as long as you continue to improve in your numbers, then you'll probably see a similar situation to me as far as your chemo. Now, as far as what to expect is with how you feel, the first day and a half for me, I feel really good. The steroids help. The all the other drugs I'm taking, my anti-nausea meds, are kind of like sedatives. They make me kind of drowsy. So you might feel like sleeping, resting. It's fine if you do. It's fine if you don't. Either way, you might feel pretty decent. Once you crash from that steroid and the Cytoxin really kind of starts doing its work, I get really sick on the end of day 2 and the start of day 3 after treatment. Treatment being day 1. And usually that only lasts a day for me. Some people report not being nauseous at all. Others report severe nausea. And just talk to your doctors. There's all kinds of drugs like Zofran, Comprazine, Amend. There's a lot. There's olanzapine, promethazine. All of those can be used different doses. I know some people personally who benefited tremendously from Zofran, and I did not. It's almost like nothing happened. It didn't work at all. So I've had great responses from olanzapine and promethazine. And whether or not you end up with something like cyclical nausea, where your brain just, no matter what happens, you're just going to get nauseous same day, same time. It's going to feel the exact same way every week. You just got to tough it out. or maybe you won't have that experience. So it's hard to say. Probably depends on your body type, your age, whether you're a man or a woman. I know they've told me, one nurse told me once that whatever they try, they can't get old men to be nauseous. They tend to do very well, and young men tend to do very poorly as far as nausea. So if you're a young guy, I'm sorry. I'm in my 40s. I get really nauseous. I'm middle-aged, but that's my experience. So if anybody has any questions or comments, or uh, if they have a similar experience or not a similar experience, let me know in the comments. And I hope this was insightful. Love you guys. Bye.